It's Dr. Karthik Ram. Welcome to my podcast. I'm a board certified plastic surgeon and educationalist based out of Chennai. I'm really honored that you have taken your time and given me your gift of your attention. Hope you are going to love this session. Please follow me in my Instagram handle for more updates. My Insta handle is Ram Dr. Karthik, RAMDRKARTHIK. Enjoy today's podcast. Why my eyes are always looking tired? Why my dark circle is never going by any creams? These are all the common questions, like we see in our clients each day's practice, our each day's practice. So, what are the causes of the dark circle? So, the dark circle, there are mainly three reasons. Okay, the first reason is the pigmentation. Okay, especially the Indian skin type, we tends to pigment a lot. So this pigmentation is very difficult to treat. You have to understand this first, because Europeans and Americans, the white skin people, usually the pigmentation is not a big thing for them. The like the blood vessels are like dark, and it appears dark in most of the people that will respond well to lasers. But in Indian skin type, problem is pigments. Okay, these pigments are very resistant. It is like sometimes when you use the creams, it looks like it disappeared, but again it comes back. Okay, so sometimes we have to accept the reality, and few pigment removing creams are available in the market, usually based on kojic acid, licorice, and these kind of things we can keep using continuously. That will help to control the pigmentation, but you can't completely get rid of the pigmentation. So one other major cause for the under eye dark circle is shadowing. Okay, so like you go to the party, and the photographs looks very bad, especially the certain types of lighting when there is a overhead lights, and in few lightings this under eye dark circles looks more prominent. But when you throw some light to see the pigments around that area, you can't see any pigments. Then you get confused why my eyes looks always dark. This is because of the puffiness in the under eye region. There is a hollow forms below the puffiness. It goes up to the root of the nose. So we call this as a tear trough deformity. Tear trough deformity. Why it is happening? Because of the various reasons. Some people congenitally, it's a hereditary thing. Some people from the mother has the same problem, daughter has the same problem, son has the same problem. So sometimes it's hereditary. Sometimes because of the aging or massive weight loss, what happens is the orbital retaining ligaments. Okay, there is a ligament called orbital retaining ligament. It becomes lax, and sometimes the orbital rim itself get absorbed because of the aging thing. Sometimes because of the septal laxity, that is a septum which holding the fat globules just below the eyelid. But because of the septal is lax, that eyelid fat get prolapsed, so that there is a bulge below the eyelid. See, when the bulge is more pronounced, this hollowness, the tear trough deformity looks more prominent. So we have to examine your problem first. So each dark circle has a different reason. So go to the doctor, go to the board certified plastic surgeon. They'll examine your problem. They'll tell you whether the fat is prolapsed, your large orbital volume, the how much bad is the fat prolapse. Accordingly, they select your treatment. See, what are the treatment available for this hollowness or the fat prolapse? One more thing you have to ask yourself is, because of the lack of sleep, sometimes the lower eyelid skin, it's very thin skin. If you compare the whole body, thinnest part of the skin is the lower eyelid skin. If you're not sleeping properly, or you haven't have healthy foods for a couple of weeks, what happens is that the whole body, like swelling comes. So sometimes that swelling will be more pronouncedly seen in the lower eyelid region. If that is the case, it's a temporary. Once you resume a good healthy lifestyle and good sleep, that will disappear. For that, you don't need any treatment, just you need a good sleep and good healthy foods. Sometimes because of the fat prolapse, because of the septal laxity, the fat below the eyelid get prolapsed, so it becomes a eyelid bag. If that is the case, only surgery is the option. So surgically, we can remove the fat prolapse under the eye by two ways. One, if the patient is a young patient, the skin quality is good, what we do is we do something called transconjunctival blepharoplasty, meaning we make the cut inside the eyelid so that scar won't be visible outside, and go and remove the excess fat, and that's it. But if the skin quality is not good and the fat prolapse is also there, what we do is we do lower eyelid blepharoplasty by cutting the just below the eyelid margin. We remove the little excess skin and we'll correct the prolapse fat. See, most of the time it alone won't help because the bone resorption in the orbital rim and the teardrop deformity also has to be addressed along with this. So how will you address it? You have to fill that area. See, most of the time when we're doing a lower eyelid blepharoplasty, the same fat what we remove, we fill in the teardrop cavity where it is already hollow. That solves the deformity as well as the puffy eyelid, so that your eyes start looking youthful again. But sometimes there is other options also available for the hollowing and the under eye puffiness. See, the fat prolapse is very minimal and you have a teardrop deformity and the quality of the skin is good. There is few temporary options to correct it. What are the options? We can inject fillers. Fillers is a usually the hyaluronic acid fillers. Lot of advancement happened in the filler industry, and so that lot of good fillers came for the under eye. So when we inject the filler, it temporarily fills this space so that that under eye, that hollowness disappears, and same time the puffiness also masked because we fill to the level of the puffiness so that it merge with the remaining cheek volume so that it won't look different. Other option is the filling the fat. We take the fat from your thighs or wherever good fat you have, we inject it under the eye so that that fills up. Sometimes because of this fillers or fat, sometimes there will be a lot of ecchymosis or bruising below the eyelid, but it usually disappears in 3 to 4 weeks in Indian people, but it's an European it wears off faster. So when you correct the deformity in the teardrop deformity as well as the puffiness, the prolapse fat pads, you get a very good aesthetic lower eyelid. If you want very temporary measures for the puffiness, there are few creams available. Before going for a party or before applying a makeup, if you apply the cream maybe hour earlier, what happens it shrinks that tighten the skin temporarily so that the prolapse looks less prominent. So when you apply the makeup or you're going to the party, it won't look obvious. So that is the other options available for the under eye puffiness. So the third issue what usually we see is the thinning of the lower eyelid. It's not very common in Indian scenario, but it will be very common in white skin people. So thinning also give a lustreless skin below the lower eyelid so that you look tired, your eyes won't look healthy. Same time, sometimes the underlying blood vessels also looks more evidently visible because of the thinning of the skin. So thicken the skin, few options are available. The non-surgical options are applying retinol-based creams. Retinol eye creams are available. That's the best option for uh, to increase the thickness of the lower eyelid skin. Normal retinoic acid will produce a lot of bruise, a lot of like irritation, burning sensation, and sometimes even wound if you apply under eye region. So retinol eye creams are always better. So other option to tighten the lower eyelid, increase the thickness of the lower eyelid skin is the collagen based supplements. Okay, a lot of collagen powders are available. If you take one sachet every day, it tightens the skin automatically. That's also a good option. So other options to increase the quality of the skin and tighten and the increase the thickness of the skin is something called nano fat transfer. See, the fat has a lot of good properties. What we are doing is we are using the good properties of the fat without giving the volume to the area. How we do it? We take the fat by doing a liposuction, and we take the small. It's not a very big liposuction. We need only 5 to 10 ml of volume. So we destroy the fat cells manually, and we keep only the liquid of the fat, and we inject it below the dermal region of the under eye. Sometimes it bruises a lot, not sometimes, always it bruises a lot, and it takes some time to disappear. It's a very good option for the white skin people, but the darker skin, as you know, the pigmentation is very difficult to go, so it takes longer time to disappear the pigmentation. So these are all the common problems what you see below the lower eyelid region. One is the pigmentation per se. It's one of the very difficult problems to treat in a darker skin people. And second is the puffiness and the teardrop deformity. There is surgical options and non-surgical options which is temporary. And third is the thinning of the skin. I hope this podcast is really useful to you, and stay tuned for the next interesting episode of our podcast. Thank you.